So my name is Mary Richardson, and I am going to talk to you today about vaping. Vaping is a term that is used when someone is using an electronic cigarette. You may also hear electronic cigarettes called vape pens. You might hear them called e-cig or a mod or a pod. But vaping is the term that we use. Electronic cigarettes they're devices that operate by heating a liquid solution to a high enough temperature so that it produces what we would call an aerosol that is inhaled. So the topics that I'm going to go over today, we're going to talk about the products, taking a page out of tobacco's playbook, the epidemic, and what can we do. All right, today's learning objectives. I want you to be able to identify various vaping products and brands, analyze vape advertising, recognize the rapid growth of vaping among youth, describe a valley, which is a vaping illness, and the corresponding CDC investigation, and discuss methods for tackling the vaping epidemic. To start, let's take a look at what these things are and what all's in them. Here you can see there are a lot of different types of vapes. They come in different sizes and different shapes. Knowing that, we can probably figure that they are made of different parts and materials, and that they probably have different ingredients in the actual vapor itself. E-cigarettes or vapes, you might also know them, somebody might call them an e-cig or a Juul. You might even hear somebody call it a puff bar. These are known in the professional sector as electronic nicotine delivery systems, or ENDS. They are the newest form of tobacco products. So tobacco products include things like cigarettes, cigars, pipes, chew, dip, snuff, snus. It also includes hookah smoking. These devices, though, the electronic cigarettes or the vapes, they are devices used to smoke or vape chemical substances. The most common active component or ingredient in vapes is nicotine, which is the addicting piece. They can also be used with things like THC, which is the compound in marijuana that gets you high, and CBD, another compound derived from marijuana that does not get you high, but it does have other side effects. Since these products are so new, having only been commercially available in the United States since about the 2000s, they're mostly untested and unregulated. What studies have been done, they show a wide array of dangerous ingredients, including lead that comes from the physical vape, the battery, and the coil that helps heat it up to make that vapor. They've also been known to have formaldehyde in it, and formaldehyde, if you were to look up formaldehyde, some of you may know what it is, but it's used in a lot of different things, but it does pose significant danger to human health. It's known to be what we call a human carcinogen, which basically causes cancer. So we see similar ingredients in these products that we have seen in other tobacco products. Those chemicals that make the product more addicting and more dangerous. While these companies claim, so the companies that make these, they claim their products are quit smoking aids, at least that's how they were marketing them. They claim that they're specifically to help adult smokers quit or adult tobacco users quit. We know that they're actually engineered to attract young people. They come in, after all, they do come in flavors like bubblegum, cucumber, PB&J. I just saw another one maybe yesterday or the day before that comes in a flavor called OMG, which is, I believe it said it was orange, mango, and guava flavored. So those aren't designed to be attracting adults. They're designed to be attracting young people. But they're also designed to look different from a regular cigarette that adults smoke. Now let's get into what these products actually are. This one is one that you're likely familiar with. It's called the Juul. Juul is the most popular brand of e-cigarettes, having 40% of the market share in 2017. It's extremely popular among young people due to its original advertising, which we will discuss later. It's sleek, it's a futuristic design, they do have fun flavors like mango and cucumber. Juuls do come in two parts, the actual device itself and the pods. The pods are little self-contained compartments that actually hold the vape juice. The pods contain the nicotine and the flavoring, as well as the other chemicals in the device. You can buy both the device and the pods online and in stores or convenience stores or gas stations. Here's another type. This is Vuse by RJ Reynolds. It's another sleek, futuristic e-cigarette made by the Camel cigarette manufacturer, which is RJ Reynolds. This is another pod-based e-cigarette. It's designed to look like a USB drive and not a traditional cigarette. Blue is one of those e-cig brands that has been around for a bit longer. It comes in either a pod form, which is the one on the left, or the more traditional e-cigarette style that looks more like cigarettes. They do have disposable ones that look nearly identical to the traditional e-cigarette on the right. So those three that I just shared with you give you a good idea of what to look for in electronic cigarettes. This particular electronic cigarette, this is called Suron, and it's a little bit different than the last three that I just showed you, but if you notice the one on the left in particular, it looks like something that you could buy at the grocery store. I know you can add those drops to water. I can't remember what the brand is, but it's similar to like Crystal Light. You just add it to a bottle of water. You squeeze a couple drops of the liquid into your water and it changes the flavor of your watering. But this one's called Suron. It is available as well. And then we have this one, Enjoy. We don't see these too often, but these are also out there. So moving on to another vaping device, this is the vape pen. It's similar to an electronic cigarette in shape and size. There are a lot of different types of these. They will have a button on the side. You can kind of see it in the picture on the left. There's a button on the side that the user has to press when they're inhaling so that it does produce that vapor. The biggest difference between pens and e-cigs like Juul or Vuse that I showed you earlier is that you fill these cartridges yourself as opposed to buying the actual cartridge or the pod or the tank from the brand. And finally we have the vape mods or box vapes. These are large boxy devices with a spout on the top. The user also presses a button on the side and inhales the vapor that is produced. This is typically what is being used when you see those huge clouds of vapor, or it looks like smoke. These, like pens, so the last slide, they're refillable, and people who are in the vape culture, they tend to get very involved in crafting their own vape juice. You're less likely to see youth using these devices than they do using the Juuls, but these vape mods are still out there. Next, I want to look at ways that vape companies are mirroring the same kind of advertising that big tobacco once did and still actually do. So e-cigarette companies or electronic cigarette companies, they've been copying tactics that were once used by the tobacco industry to reach similar markets. So as you can see in these two particular ads, the one on the left is probably several decades ago, maybe even in the 1940s or 50s, where they use the same type of messaging in both of these ads. So on these two particular ads, they're using sex, the idea of feeling good, and being slim in their advertising. So if you were to look at the way electronic cigarettes advertise, a lot of their ads directly mirror those once put out by big tobacco companies. So when you look at these two particular ads, they use women in these ads. And the one on the left is actually from, if you were to look at the date down on the bottom right of that ad on the left, this ad is actually from the 1930s. Now, tobacco has been around, cigarettes have been around since at least the 1800s or so. And if you were to look back and do some research on the history, it was actually frowned upon when women were seen in public smoking. So big tobacco was looking to increase their consumers or who's buying their products, so they started using women to advertise, just like on this ad on the left. So they wanted to thank you for your patronage, Miss America, and then you see the one on the right, and it's very similar. It talks about being fashionable, stepping out into style by using these products. Even when you look at the wording, electronic cigarette companies are using some of the same types of wording. On these two ads, it's talking about satisfaction, man-sized satisfaction, clean, smooth, and fresh. And then the other one, the electronic cigarette, it's for all of us smokers wanting satisfaction. This is what it looks like. In this particular ad, ads, the idea of don't quit, switch, it wasn't invented by e-cigarettes. So the one on the right is from an electronic cigarette, and it just says, why quit, switch. But that's not something that was just created. As you can see on the ad on the left, the ad, it says, with all the talk about smoking, I decided I'd either quit or smoke true. And he decides, or the ad says, he smokes true. So you can't really read it here on the ad on the right, but down towards or right above where it says visit bluecigs.com, can't read it because it's blurry, but it does say nobody likes a quitter. It's actually almost shaming people who want to quit smoking. When Juul first came on the market, they actually used advertising through social media influencers, and the concept of a new way to actually smoke. As you can guess, they received a lot of backlash for these tactics, and in response to that backlash, they've actually switched tactics, and now they're using or promoting switching success stories. So they use that on their website, and they try to use other avenues of advertising. So the Juul advertising that I just talked about on the last slide, it's very similar to what Philip Morris has done recently. Here you can see an ad that ran in the UK encouraging folks to quit and to start using their brand of e-cigs. So I'm just going to spend a few minutes on talking about the actual epidemic or the numbers of youth who are using these products. This chart actually shows you cigarette use and electronic cigarette use for high school and middle school students. So the blue lines are for regular cigarettes, the red and the yellow are for electronic cigarettes. As you can see, the blue over a period of time since 2011, it continues to kind of go down, but the red and the yellow, which is electronic cigarette use among high school and middle school, so the red is high school, yellow is middle school, that has continued to climb even more significantly since about 2017. So this is obviously concerning. So as of 2019, we have more than 5 million youth currently using electronic cigarettes. That's an increase just in 1 year from 3.6 million to now 5 million. So I just want to talk to you a little bit about nicotine and the effect that it has on youth. With so many young people using these products, it's important to look at how it's going to impact them long term. We know that nicotine actually changes how your brain works. So our brains are not actually done forming until around the age of 25. So these effects can be highly damaging to young people. When we use nicotine, it basically hijacks receptors in your brain and it makes them specifically nicotine receptors. Nicotine is the same size and shape as a neurotransmitter called acetylcholine. Acetylcholine actually carries messages around in your brain that are related to movement, memory, alertness, and other things as well. So nicotine, it actually sneaks into this receptor, the acetylcholine receptor, so that messages aren't getting around to where they need to actually go. So because these receptors are so full, more than the amount of acetylcholine that has been released into your brain gets confused and it stops releasing acetylcholine because it thinks it's being overloaded. So now messages, they're not getting sent where they're supposed to go. Once your body adapts to the nicotine and the acetylcholine taking up the same spots, it needs nicotine to function normally. This is why when you go without nicotine, you have those withdrawal symptoms. Those withdrawal symptoms of, headache, irritability. So nicotine, it actually also activates dopamine, which is the pleasure chemical, making it so that you don't feel good without it. It's temporary, obviously, and your brain will regain the ability to function normally after you quit. So if somebody quits, it will go back to being normal. Some of the potential effects of nicotine on young brains, it can cause mood disorders, lower impulse control, and shortened attention span. Another thing that nicotine actually does is it's a primary factor for addiction by opening up that addiction pathway in your body. Basically, nicotine draws the map to the dopamine and then it shares it with other substances when you use them, so making it easier or far more easier for you to become addicted than for them to never use nicotine. Apart from the dangers of addiction and brain development, recently we have been in the midst of an outbreak of a mysterious lung illness that's directly tied to vaping. The CDC is investigating but has yet to been able to identify a singular cause or even to actually name the illness. Right now it's just being called EVALI, which is e-cigarette or vaping product use associated lung injury. Like I said, it's still being investigated. There's a lot of cases throughout the United States, and there's actually been several deaths as well. This illness has occurred in people using nicotine, THC, and CBD containing vapes, and the symptoms are very broad, but they can include, or they do include, things like cough, shortness of breath or chest pain, nausea, vomiting, diarrhea, fatigue, fever, or abdominal pain. The CDC is recommending that anyone currently vaping should talk to their healthcare provider about quitting. So, what can we do about this issue? Well, I told you before that tobacco use, more specifically cigarette use among youth, it has been on the decline for decades. However, now we're seeing e-cigarette and vape use among middle school and high school students. It's been on the rise. The popularity of e-cigarettes and vapes among youth is of concern for health professionals, educators, and even parents, in part because of the common misperception or the misconception that these products are harmless, and also because their long-term consequences or those long-term health effects of e-cigarettes or vape use, it's still not known. I had explained earlier that regular cigarettes have been around for a long time. Just thinking about that ad that I showed you from the 1930s. They've been around for a long time, so they've had a long time to study those long-term effects. So just make sure that you educate yourself, look for that trusted information, and we'll talk in a couple of slides where you can get some trusted information. So things that we can do, or healthcare providers can do, treat e-cigarettes and vapes and other electronic nicotine delivery systems, treat them the same way we do tobacco products. Include these products when discussing cessation, because a lot of healthcare providers, they are already asking about tobacco use. So include these type of products in that discussion as well. Try to stop it before it starts. So at your organization, some organizations are enacting policies that already prohibit using those electronic nicotine delivery systems. And then treat in-house. If you have somebody that you see in your practice, if you have a treatment specialist, a tobacco treatment specialist, see if they are interested in quitting and refer them to those counselors. But also know that there are resources here in our county. Licking Memorial still has their Quit for Your Health program, and the health department has a couple of tobacco treatment specialists, as well as referring to the My Life, My Quit web site and the phone number, the text-based service. And the Ohio Tobacco Quit line is part of that as well. So My Life, My Quit is part of the Ohio Tobacco Quit line. Another thing that could be a possibility is getting involved with the TURN group, which is Tobacco Use Reduction Network. There are different components or pieces to the TURN group. There's different work groups. So one work group works on youth prevention, one on cessation, and one on actual policy work. So if you're interested in participating or being involved in the TURN group, you can contact the health department. You can actually contact me to get involved. A lot of healthcare providers, including yourself, you're probably already doing this as part of your screening process, using the 5 A's, where you're asking about that nicotine or the nicotine products or tobacco products, but don't forget to include vaping or electronic cigarettes, juuling, the different names that it goes by. Don't forget to include that in there. Talk to them about quitting or advise them to quit, and then assess their willingness to, see if they are interested in quitting. Some folks aren't interested. And if they are interested, assisting them to get those resources, like using the health department cessation counselors, as well as the Ohio Tobacco Quit line and Licking Memorial, and if they are young and qualify for the My Life, My Quit, utilizing that as well. So for healthcare providers treating a vape user, the counseling component is actually the same as it is for other tobacco products or nicotine products. However, the NRT, or the nicotine replacement therapy, it's actually more complex. That's because there's irregular levels of nicotine in those vapes. Sometimes those vapes have higher concentration of nicotine. We'll actually go over that in a couple slides. And there's actually a higher dose per use. So the combination of patches and gum or lozenges or any kind of nicotine replacement therapy, it may be necessary. A standard pack of cigarettes contains 20 cigarettes. So that's the picture on the far right, or far left, I'm sorry. So it contains 20 cigarettes. And that means that there's 1 milligram of nicotine absorbed per cigarette. So that's about 20 milligrams of nicotine in one whole pack of cigarettes. Unlike other e-juices, which may or may not contain nicotine, all salt-based e-juice contains nicotine. And I will talk about salt-based on the next slide. But all salt-based e-juice contains nicotine. According to Juul Labs, one Juul pod contains 41.3 milligrams of nicotine. So that's equal to the same amount as 40 cigarettes. Almost 40, basically 41 cigarettes. So this is a high amount of nicotine, and it can be intense for first-time users. So our concern is that young people, they're being introduced to this, to a high amount of nicotine, and it can develop a tolerance really quickly, and they can become addicted as a result. So the next one I have here is a fix pod. So the fix pod actually has 75 milligrams of nicotine, so that is the same as 75 cigarettes. And then we also have the next one, which is a Suron pod, and Suron cartridge contains up to 90 milligrams of nicotine, or that's the same as 90 cigarettes. So that's almost equal to about 4.5 packs of cigarettes. No matter what pod device someone is using, all of them contain high levels of nicotine, which is extremely addictive. So our biggest concern with pod-based e-cigarettes among young people is that they can deliver the same amount of nicotine released from 1.5 to 2 packs of cigarettes. All salt-based e-juice or liquid contains nicotine. So older generations of electronic cigarettes or e-cigarettes used a form of nicotine called free-based nicotine. That's like the picture on the right. You see this one, it has 25 milligrams of nicotine. It's a refillable tank. The one on the left, the most recent generation of e-cigarettes on the market, they include a pre-filled pod system like Juul and refillable systems like that Suron drop we had already discussed, and something called candy pens. They use nicotine salts in the e-liquids. So the nicotine salt formulas, they're actually to allow for much higher levels and efficient delivery of the nicotine with less irritation compared to the earlier generations of electronic cigarettes. So this prompts a lot of questions and concerns, obviously about the use of these items, the purpose, and actually the safety, especially with the high amounts of nicotine. While using an electronic cigarette is often called vaping, the device produces an aerosol, not a vapor. Unlike vapor, which is simply a substance in the gas form, the aerosol from the e-cigarette contains tiny particles from both the liquid solution and the device, which could be metals from that heating coil. There's evidence to suggest these particles can lead to cardiovascular, which is your heart, cardiovascular injury with links to negative effects on resting heart rate, so your resting heart rate when you're sitting there and your heart's just beating, blood pressure, and cells that line the blood vessels. For healthcare providers who are treating tobacco users, this is for adult tobacco users because nicotine replacement therapy has not been approved for youth. But the client, just remember that the client is likely more addicted to nicotine if they do vape, and they probably have a higher tolerance. Therefore, the highest dose of patches, it might not actually work. Possibly, if you are treating somebody that vapes, maybe start with gum or lozenges to wean them down before using that patch, or use both of them in conjunction. Encourage them to use those coping skills if you're familiar with that. And just remember there's no concrete clinical recommendations for medication to treat vaping because it still is fairly new. Here are some tips to talk to youth, or when you are talking to youth about vaping and nicotine. So obviously we want to make sure you know the facts. That's why we wanted to present this to you. You can also look at what information the CDC has on vaping, and check out the Surgeon General. Be patient and be ready to listen. Avoid criticizing them. It's okay for the conversation to happen in spurts. And it's just like with anything, right? Don't be surprised at what they actually tell you. I'm sure at one point you may have heard somewhere along the line somebody started saying that they heard that vaping fruit flavors actually gives you a serving of fruit. So don't be surprised at what they do tell you. Obviously that is false. And what happens if they're already vaping? Obviously we want you to try to be able to maintain an open dialogue. Young people use substances for different reasons, and a lot of times we find with vaping it's because a lot of other students or youth are doing it. Learning why can help you in working with them to stop. Avoid using scare tactics. Remember, they think they're invincible. Also talk to them about their values, maybe with money or image or sports or extracurriculars. Kind of all ties together. I like to use the money as an example, especially with younger kids, even high schoolers, just talking about what if you don't use these products, whether it's regular cigarettes or vape products, how much money you can actually save just by not buying them. And then I also do remind them when you use these products, you have nothing tangible to show for it. And of course, you can help them access care. The My Life, My Quit is a quitting program. It's actually specifically designed for teens, so under 18 and under. It's completely free. It's easy to use. It's actually they can use texting-based services. You can also access services here at the health department or at Licking Memorial Hospital. So treatment for youth is going to be a little bit different. Cessation counseling is going to be similar, but it does use, or we recommend using the evidence-based techniques like practical counseling, motivational interviewing. This can be done in person, a phone call app, or even texting. A lot of youth would prefer texting over phone calls. They do have a texting-based quitting service for youth with vaping called My Life, My Quit. But medications, unfortunately, there are no quitting medications available that have been approved for youth to use. To conclude this presentation, I want you to know that vape products, they come in all different kinds of sizes and shapes. They're not actually always easy to recognize. As you can see when you look at our first couple that we took a look at in the pictures, some of them do look like USB drives, and a lot of youth do use USB drives for schoolwork. Vape companies, they actually are using the same tactics as big tobacco to get a new generation of smokers hooked. Vaping among young people and youth, it's actually increased by almost 80% in recent years. A lot of young people don't see vaping as the same or as using tobacco products. They think it's different. Vaping illnesses have occurred in 49 states, and they've actually resulted in numerous deaths. Nicotine does harm young brains, those developing brains that aren't fully developed until mid-20s. There are simple tactics healthcare providers can use to address youth vaping. Here are resources for more information. The health department has some resources. The My Life, My Quit, which also has to do with the Ohio Tobacco Quit Line, which a lot of you are familiar with, and the CDC has information. If you have any questions, let's say that I went over something in this presentation and you just need some additional information, please email me at mrichardson@lickingcohealth.org. Thank you so much for watching this video. Please do not forget to complete your evaluation. If you're unable to click on this link, I will share it as another attachment or a link so that you're able to take that evaluation. We ask that you do it. It's a simple evaluation. It's only about 4 or 5 questions. We appreciate your help in taking that so that we can get credit.